Namaskar. Today we are going to learn about the remedy Cocculus and we are going to do it from various Materia Medicas. Let's start with what Dr. N.M. Choudhuri says about this remedy. He tells us Cocculus Indicus occupies a very high place in my estimation. The regard with which I hold it is particularly due to its great usefulness. In days of my hardship, when cases were few and far between, and when cures were rarer, Cocculus came to me as a godsend in the treatment of a lady in the last throes of agony of climaxes. So you see, there was a case which came to Dr. N.M. Chaudhary in his early practice days, and he prescribed Cocculus, and the lady got cured, and that is why he says that Cocculus came to me as a godsend. And this case procured for me a lifelong friend who has ever since been acting in the best of my interest and to whom a big portion of my prosperity of later years of practice is due. Dr. N.M. Chaudhary. Okay, so Cocculus became his lifelong friend who helped him every time and to whom big portion of his prosperity he is giving the credit to, right? And this tells us how important this remedy is in our day-to-day practice. Okay, so now let's start with the understanding of this remedy. So, as always, beginning with the basics, let's start with the understanding of the common name in the family and its use in normal crude form. Okay, so common name of this remedy is Indian cockle and its family is Menispermaceae, and it was in ancient times actually used to stupefy fish and thus render them an easy prey. So, it stupefies fish. So, it has some kind of action on the sensorium, is what we can understand until now. It was used extensively. It is actually used extensively even at the present time in adulterating malt liquors. Okay, and why so? Because it also produces great disturbance of the sensorium in human beings. Again, the same thing. Okay, that is why it is also used in adulterating liquors even today. So, by understanding its use in it as a crude material, as a raw material, crude material, we can understand what action it will have even in the potentized form, right? Then we see that the active principle of this remedy is picrotoxin, and this picrotoxin has action on the cerebrospinal system and especially on the lumbar spine and the part of the CNS that controls the muscular movements, especially the cerebellum, which is the cerebellum actually. So picrotoxin has an action on cerebrospinal system. So normally it has an action on cerebrospinal system. So when we potentize it, it will again also have an action on CNS. That is what we understand until now, and hence it produces kind of paralytic movements. So just on the basis of this, we can first understand that it has some kind of action on sensorium, in which it does disturb the sensorium, it stupefies the sensorium. Okay, so stupefaction and disturbance of the sensorium is the action that it has on the mind. Okay, and when we talked about the active principle, we understood that it has a kind of action on cerebrospinal system, and when we talk about cerebrospinal system, we understand that there can be paralysis as a reaction, as an action, because if it is acting on cerebrospinal, it is acting on the nerves, and when it is acting on the nerves, we'll get paralytic movements, we can get, and especially on lumbar spine. So maybe there is backache, and maybe there are various different problems, and part of CNS that controls the muscular movement. So again, muscles, so muscle related issues may be also found because the CNS that controls the muscles is the action of this active principle. Moving on to the constitution, and finally we are going on to the main part of Materia Medica actually. So let's see, a Cocculus is suited to persons of mild and sluggish temperament. We've already done a great famous remedy of sluggish temperament, which was, I hope you remember, it was Calciriaca. Okay, Calciriaca. So these people are also of mild and sluggish temperament. They have light hair. They are hypochondriacal. This is very important. They are very anxious. Okay, anxious about health, anxious in general. They're timid. They're fearful. Again, fearful and nervous persons, as Dr. Clarke says. Now, whenever we understand the constitution of any remedy, we need to also keep in mind that this constitution that has been given in our Materia Medicas is to be studied, but it is not to be taken very seriously, because it's not so that every patient that comes to you who actually is Cocculus will be looking like this. Okay, light haired. No, it's not like that. Anytime you study constitution, it's not the case that the patient coming to you will come with the same kind of constitution. Okay, but more often you can find this type of constitution, or even you see in the provers, the provers having light hair will prove this remedy better. Okay, so in that kind of way this constitution is helpful, but when we study it, you should not think that the patient who has these kind of features will only get cocculus. No. And this remedy cocculus actually was first introduced into our Materia Medica by Dr. Samuel Hahnemann, and he actually first proved it on himself, and he also proved it on his own disciples. Okay, and now we will talk further about various points. First of all, we'll talk about some general points which are very important for the whole remedy. We'll not go into the particulars directly, meaning we'll not directly discuss about the head symptoms or the GI symptoms or the respiratory symptoms. No, we're first going to talk about the few general points related to this remedy which more or less apply to the whole of this remedy. Okay, and the first point will be ailments from for this remedy. So what are the causative factors, okay, that play a role in causing disease in cocculus? Okay, and then we will also talk about this paralytic condition. Okay, Dr. Kent has very beautifully explained about this, and we will talk about that also, and many more such points which are very general but very important characteristic points for this remedy. Okay, so let's start with the first, that is ailments from. So over here in ailments from, whatever ailments, whatever causative factors we are going to study about are the causative factors which are found almost everywhere in this remedy. So you study the hair symptoms of cocculus, or you go and study the GIT symptoms, you will more or less find this cause present somewhere or the other. We've just now seen that this remedy has a great action on central nervous system. It has great, it is a great paralytic remedy. So even in the cases of paralysis, when you go and meet the patients, when you talk to them, you'll find the causative factors to be this kind of factors. So that is why this is a general thing for that remedy. Okay, any kind of complaint that this remedy has may somewhere or other be related to this causation. Okay, so the first causation that we see, which is very important for this remedy, is becoming worn out by anxiety, worry, and loss of sleep. So here you see what the case is, that there is a patient. Okay, there is a patient, meaning this cocculus lady actually lives in a house, and maybe her daughter is ill, maybe her husband is ill, maybe her mother-in-law is ill. Okay, some relative of her, very close relative, is ill. Okay, and this is our cocculus. So she will like go and serve this patient, take complete care of this patient, and since this patient is very ill, very sick, so she will be in an anxious kind of state. Okay, she will be in a constant anxiety, that anxiety about their health actually, and she'll be constantly worrying about that patient, and worry so much, and have a lot of anxiety, so much anxiety that she cannot even sleep because of that. Okay, so this whole combination of things, like there is this anxiety, there is worry, there is loss of sleep, all of these things together when present in the patient, then, and that being a causation for a disease, is an indication for our remedy cocculus. So it is not actually about when many authors actually say that nursing is the cause of cause of disease in this patient. So nursing, meaning here we are not talking about the professional nurse. Okay, complaints from nursing. So we are not talking about the professional nurse. We are talking about this kind of nursing that is being done, because here a professional nurse won't have a lot of anxiety, won't have a lot of worry for the patient as much as a loved one or a family member will have, and that is absent, and that is why it is not an ideal case for cocculus, and hence this is what we need in a case. So sleeplessness, nursing the sick, this is a rubric taken from the Kent's repertory. So there's sleeplessness because of nursing the sick. Okay, example, wife nursing her husband, daughter nursing her father. So this kind of a situation is there. Then we see that there is anger effects of. So this patient cocculus has a lot of problem from anger, especially the liver getting affected. We'll talk about it further when we talk about GIT, most probably in the next video. So anger effects off, you see, even Clarke mentions this as a very important causation, anger being a very important causation. Many authors give great importance to anger over here because it is so much. Okay, there's and you know, we just talked about this nursing. So when she does this day in and day out for a lot of time, and she is anxious for months now, she's worrying a lot, and she's not able to get sleep. Now this makes her exhausted. Obviously she's going to get exhausted because of that, and she's unable to sustain any mental or physical effort now. Okay, not just physical effort, because she's been putting so much of her body into doing all of this, you know, working to a day and night, but even mental, because she's been uh, having so much anxiety that her even her mental state is not has not been at peace for so long. So now she cannot take any mental or physical effort also. She is weak in the knees, weak in the back, and when the time comes for her to sleep, she cannot sleep. So this over here, this until this whole para has been actually written by Dr. Kent. So now Dr. N.M. Choudhuri explains this even more beautifully so that we understand what is what is the meaning of this weak in the knees, weak in the back, right? So now he says that this Cocculus patient is constantly complaining of his back as if paralyzed. Now his back, okay, his back is feeling as if paralyzed. See, we had seen that there is this action on the lumbar spine that picrotoxin has, the active principle has. So now you see that it is coming into some actions, it is coming into some, you know, this, because we can now remember it that way. Okay, so complaining of his back as if paralyzed. We notice unwielding of lower extremities. They cannot lift their legs while walking but drag them along. They cannot lift their legs. Okay, so much is the kind of numbness, kind of paralysis that is taking place. Knees sink down from weakness and they practically totter while walking. They're not able to walk normally now. They're tottering while walking as if about to fall. Soles of the feet go to sleep. Symptoms like these are particularly characteristic of Cocculus and should direct our attention to this remedy. So remember what N.M. Choudhuri says, that symptoms like these are particularly characteristic of what? Of Cocculus, our remedy, and should direct our attention to this remedy. So these are so characteristic that when you see these kind of symptoms in your patient, you have to think of Cocculus, right? And he is now saying that other ailments from other aggravating factors are the sensitiveness to noise. So this has also been written very much by various authors. They're very, very sensitive to noise, especially Clarke puts great exaggeration on this symptom. Okay, there's sensitiveness to touch. Now this sensitiveness to touch is very, very great and serves to indicate Cocculus in preference to other remedies in many affections where this is pronounced. So there's a lot of sensitiveness to touch, and especially in articular rheumatism, ulcers, and neuralgic affections of the bones. When this is present, you have to think of Cocculus. Okay, Lee's jar is unbearable. Motion sickness. Now this remedy is very, very famous for motion sickness, and we are going to talk about that in detail. We'll have a detailed discussion on what happens in motion sickness and why there is motion sickness in this remedy in the due course. Okay, there is overstraining mental and body, as we've just seen. This situation is there, and because of this situation, obviously the our Cocculus lady is completely, you know, overstraining herself in the care of the patient that is there in her family. Overstraining mental and body, tea drinking and sun can also be the causes. Okay, so what did we understand until now? We talked about the ailments from in which we first saw this situation. I hope you remember about the situation. Anxiety, worry, loss of sleep. Anger is again a very important point. Clarke mentions a lot about anger also, sensitiveness to touch also, noise also, and sensitiveness to touch is also there. Another remedy we'd seen this was China, right? We do not usually remember China for that, but it is there in China also. The sensitiveness to touch is very great and serves to indicate Cocculus in articular rheumatism, ulcers, neuralgic affections of bones. And if this situation is there, what happens? This happens. She's not able to walk. She's has this unwielding of lower extremities, cannot lift legs while walking. All of that situation, okay, all of that scene is there. Lee's jar is unbearable. Motion sickness, which for which it is very, very greatly and famous, and overstraining and tea drinking and sun. Okay. Now moving on to talk about the paralytic symptoms of this remedy, as we've seen that the active principle has an action on CNS. So hence finally producing paralysis. Now let's see what happens in that. When talking about this whole paralysis related thing, Dr. Kent actually paints a very beautiful picture in front of us. He actually mentions how this whole thing happens, right, starting from the slowness of this remedy and finally leading to complete paralysis. Okay, so there he actually divides it into three stages for our easy understanding, and he lets us know that the first stage is slowness, okay, and then comes a kind of paralytic condition, and then finally complete paralysis. And if you're not understanding what it is all about, let's understand it, let's read it, and we'll understand it in detail. So this nail shows the slowness of this remedy, and it's very very characteristic in this remedy, and that is why we are going to study it in, and Dr. Kent writes a lot about it actually, and that is why we're going to study it in detail. Dr. Kent says Cocculus slows down all activities of the body and mind. So not just of the body and not just of the mind, both. It will slow down, producing a sort of paralytic weakness. So, what is this? So, all the nervous impressions are slow in reaching the centers. If you know this, pinch this patient on the great toe, he wants a minute and then he says, oh, instead of doing it at once. So, obviously, when you're stimulating someone and you're giving them pain, then they have to immediately react to that, right? But this patient will take a minute to even do that. Okay, that slow he is. In response to questions, he will answer very slowly after apparent meditation, but it is an effort to meditate. Okay, so he is responding after a lot of time, and you feel that maybe he's thinking about something before answering, but it is just apparent, it is just an effort to meditate. He's not able to even think clearly. He wants plenty of time to turn the head cautiously to see things. Okay, so turning the head is also a problem. Cautiously he has to turn his head to see things, and this actually has a different cause. That is because his eyes are not able to accommodate the movement that's going on, and we will talk about that when we talk about the motion sickness. Now he wants plenty of time to move, okay, also to move, so the movements are slow, like in the snail moves very slow. Okay, so it's just an example for us to remember. So the movements are also slow, even the thinking is slow, and everything is slow. The whole economy is slowed down, inactive is what Dr. Kent tells us. Okay, so this kind of a slowness is present. Now first comes this slowness, and then a sort of visible paralytic condition. So what is this visible paralytic condition now? So in that visible paralytic condition, Dr. Kent tells us there comes a kind of paralytic stiffness, a paralysis of tired body and mind. So now this patient of ours, this lady, has done so much, yeah, that now her tired body and mind has finally gone into paralytic stiffness. So Dr. Kent adds to tell us that a man will stretch out his leg on a chair. So now over here, in the situation that we are talking, a woman obviously will stretch out her leg on the chair, and he cannot flex it until he reaches down with his hands to assist. So you see that kind of stiffness that is there. And Dr. Kent also says that this is very strange, because you're not able to clearly diagnose the condition. It is not even complete paralysis, it is not even complete normal function. So the patient is just stretching his leg, and he is not able to flex it without the help of his hand. That kind of a paralytic stiffness comes forth. Okay, and after that sort of visible paralytic condition, finally comes complete paralysis. So in complete paralysis, you see that the rectum is paralyzed, and that is where there is inability to strain at stool. There might be paralysis of the eyes, and hence some paralysis of muscles of accommodation. Actually, paralysis of face can also be there, limbs, throat, and paralysis of throat, cannot swallow after diphtheria, especially post diphtheric paralysis can also be there, of muscles everywhere actually. So we had only in the start only we had seen that this remedy also has an action on the part of the CNS that controls the movements of muscles. So now the muscles everywhere will go into paralysis, and even of lower extremities after diphtheria. That is Dr. Mood. Actually, this is actually a case given by Dr. Mood, which Dr. Kent tells us. So Dr. Kent actually says that he remembers a case of paralysis of lower extremities. Okay, so that was actually prescribed for by a very careful homeopathic physician many years ago. It was one of the things that surprised Dr. Kent also in the early days of his practice and observation. So Dr. Kent says that Dr. Moore was a very careful homeopathic physician. He was actually the pupil of Dr. Lippe and Herring. That is why he was so great, maybe. And he actually studied the case very carefully. There was this little girl who had this paralysis after diphtheria, and there was no hope for her. But Dr. Moore studied the case very carefully, and he understood that the remedy for this little girl is Cocculus. And after giving Cocculus to this child was completely perfect, and the case just cleared up. And Dr. Kent says that I have never ceased to wonder at it. It was a good prescription, perfectly in accord with all the elements of the case. So that is how Dr. Kent was very much inspired and amazed and at wonder due to this case, okay, because and on this case, about this case. And this is paralysis and this remedy with pain. Okay, so this is the whole condition that we see. There's this slowness and finally leading to complete paralysis, as you might have understood until now. So first is this slowness of body and mind, then becomes this paralytic weakness, in which there's paralytic stiffness actually, and then finally complete paralysis. So these were two important general things that we learned about. First we learned about ailments from, and now we learned about the paralytic kind of situation of this remedy. Let's move on to talk about a few more characteristic general symptoms of this remedy. So there is a sensation of hollowness and emptiness in this remedy. All authors talk about it, and this symptom is actually present everywhere in this remedy. Let's read. Dr. N.M. Choudhuri says that this is a very characteristic symptom of Cocculus. This is complained of almost everywhere, like in the head, in the chest, in the abdomen, anywhere and everywhere it is present, and it is a feeling as if the cavities of the body have been deprived of all their contents, and that there is merely a sensation of emptiness, goneness, and nothingness left inside. Can you imagine how it must feel like that? How it must feel. It is really something to wonder about. Okay, and allied to this is a sensation of lightness of the body. Dr. Clarke also tells us this, that along with this kind of hollow and emptiness, there is this lightness sensation of the body. Okay, so this is also a very very important point related to Cocculus actually. And there's also this constant tendency to faint in these patients. Faintness, hysterical, is also a rubric from Dr. Kent's repertory. Fainting on moving the body, fainting from pain, fainting from colic. So fainting from various different reasons you might not even think about. Even just moving the body is giving them this kind of this fainting. So they have this constant tendency to faint. Numbness is quite a feature of this remedy, is what Dr. Kent says. So numbness is very important, again, because the action is a CNS, and CNS means nerves, and since there's nerves involved, so there can be two things. First, that there can be numbness, there can be a lot of paresthesia. So now in this case we see a lot of numbness. Numbness of lower extremities, in the fingers, in the shoulders, of the side of the face, everywhere. Prostration and nervous exhaustion accompany most of the complaints of Cocculus, is again what Dr. Kent says. So you see prostration and nervous exhaustion everywhere in this remedy. Any and every complaint that this patient has, along with that, prostration and nervous exhaustion will be present. Again, if you remember this remedy through this situation, it is very much helpful for us. It is very easy to remember. Because she has been working so much, she'll obviously be prostrated. She'll obviously be exhausted because of that. Okay, so right now we saw this four important points. First was the sensation of hollowness and emptiness, and there was constant tendency to faint. Then there was numbness, and then there was prostration and nervous exhaustion. Okay, now moving on to a very 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 famous thing about this remedy, which is motion sickness. So let's finally understand in detail about the motion sickness of Cocculus. We all know that it is a great remedy for motion sickness, but what are the actual symptoms, and why is this motion sickness particularly present in Cocculus? Okay, what actually is the what aggravates it? So she gets into a car to take a journey. So our patient has problems from all kinds of motion sickness, all kinds of traveling. Okay, even if she moves or takes a journey through a car, a carriage, which is mentioned in our Materia Medicas, old Materia Medicas, a boat, a ship, a train, a bus, whatever, any kind of traveling she does through any kind of transport vehicle that she uses, is finally going to give her this sickness. So let's see what happens. So she gets a sick headache. So the first thing you need to remember again is headache. So in motion sickness she gets headache. Pain in the back is also there. Dizziness, meaning vertigo, is there. Nausea, vomiting. So nausea is actually common. Any and everybody who has motion sickness gets nausea, vomiting. There's vertigo in this patient. There's headache in this patient. There's pain in the back in this patient. Okay, now see, there are a few very characteristic or very not so common things. So while traveling, she feels weak all over. She feels as if she would sink away. This sensation of seasickness and dizziness is sometimes felt all over the body, a sort of faint feeling which is followed sometimes by loss of consciousness or a paralytic rigidity. So, two important things. She would sink away, so that is what she feels, and she has a kind of faint feeling. This is not normally that everybody feels. Everybody doesn't feel that they would sink away. Okay, and along after this whole situation, there will be loss of consciousness or even paralytic rigidity may come on. Okay, now this Cocculus patient cannot endure motion, obviously, that we have understood until now. Aggravation is from talking, also from motion, and now we understand the important thing, that is motion of the eyes aggravates. So this is very important. Dr. Ken tells us, and now it is very beautifully explained. He says that a Cocculus case cannot just look out of the car window. He or she cannot look down from the boat, and that is because seawater moving, okay, anything moving they cannot see without nausea. So if they're seeing something which is moving, they're moving and seeing the water, they're seeing the moving trees along the roadside or anything, that will give them nausea immediately. They cannot accommodate eyes to moving objects, and gives them dizziness, whirling, and headache. Headache as if the skull would burst, or like a great valve opening and shutting. This is the kind of headache, and we'll talk about it in detail when we talk especially about the head, mostly in the next part of the video. Okay, so that is the whole situation. They have this motion sickness with headache, pain in back, dizziness, nausea, vomiting. They feel as if she would sink away. She feels as if she'd sink away. Faint feeling is there. Finally, there's loss of consciousness or paralytic rigidity. Motion of the eyes is the main aggravating factor. Eyes are the main senses which are causing the problem. So they're watching out of the car window and they're seeing everything moving, and the eyes cannot accommodate to the moving objects, and finally leads to vertigo and all the complaints. Okay, and obviously the other things are there. The normal physiology is obviously there. Okay, but in these patients, the eyes aggravate a lot. Okay, the vision aggravates a lot. Their motion sickness. Next, moving on to the nausea of Cocculus. Since we have just not been talking about nausea, let's understand a little bit more about nausea in general. The nausea of this remedy. So the nausea of Cocculus is, mostly it's like vertigo and nausea will be present together only, and you go to the bedside of the patient. And right now we're not just talking about the motion sickness. Obviously, along with motion sickness, also the nausea is present. But even in general, you go to the bedside of the patient, ask the nurse, what have you been feeding the patient? Okay, just now you talked about feeding, meaning you talked about food, and the patient gags, meaning what? Even the thought of the food, even if thought of food that the patient has imagined makes the patient gag. The nurse will say every time she mentions food, the patient gags. So now we understand, even the thought of food or the smell of food even in the other room or kitchen will nauseate this patient. And it's just like colchicum. We've already done the remedy colchicum. We've seen that there's this important characteristic symptom, and that even the thought and the smell of food will aggravate the nausea, will cause the nausea in colchicum. But Dr. Emil Tyler, while mentioning that Dr. Kent has told this and that about the remedy, also says that arsenic and CP are also comparative remedies for the same condition, that is the smell or the thought of food aggravates the nausea. Okay, next, moving on to vertigo, we see that they have a tendency to fall sideways. So whenever you talk to any patient of vertigo, you have to ask them where that they are tend to fall, forward, backwards, or sideways, because there are various remedies that we have, and you can differentiate remedies broadly using this symptom. Okay, so Cocculus has a tendency to fall sideways, and this lying down becomes necessary because they feel better by lying down. Nausea along with that. And why does this vertigo first come on? Again, from motion, that is motion sickness. Okay, from watching and loss of sleep. So loss of sleep, as I told you that these were the general points of the remedy. These are the general points, so they will be there all over the remedy. So loss of sleep was a ailments from that we've talked about, and any and everything that this patient has might somewhere be related, can somewhere be related to this kind of a causation. What I go eating after, and eating after reminds me of dyspepsia. So this remedy is a great remedy for dyspepsia, but we might not know about it. So Cocculus is a great remedy for dyspepsia, as Dr. N.M. Choudhuri tells us. So we will read about that. We'll talk about that in the next part when we talk about GIT also. So vertigo rising from bed on. So these are the kind of symptoms that the patient has when he is suffering from vertigo. Okay, now we're done with what we were going to be talking about in this part. Let's just quickly revise all of it. So when we first talked about Cocculus, we actually read this beautiful experience that Dr. N.M. Choudhuri has had with this remedy, and how it has helped him, how this remedy became a friend of Dr. N.M. Choudhuri, okay? And it can also become a friend of us if we study it in detail, if we go back and read it from various, even more different Materia Medicas, various different authors, will for sure help us. And we have actually not studied about the mind of this remedy, and Cocculus's mind is also very, very interesting. It is also somewhat similar to carcinosin, but we'll study what Dr. Kent has talked about, what Dr. N.M. Chaudhary has talked about, and it's also very interesting actually. So we'll study about that in the next part. Right now, we'll just discuss what we did. First was, after the experience of Dr. N.M. Chaudhary, we talked about the common name and the family. So the common name was Indian cockle and the family was Menispermaceae. And then we saw that in the ancient times it was used to stupefy fish, and it was also used in adulterating malt liquor. So that also showed us its action on the sensorium, right? And then we saw that the active principle of this remedy is picrotoxin, and this picrotoxin has actually an action on CNS, especially on the lumbar spine, and also on this part of CNS that controls the muscular movements, right? And then we've seen that hence it produces a kind of paralytic situation. And we talked about that paralytic situation also. But after that, first we talked about the ailments for this remedy, which were very important: worry, anxiety, sleeplessness, or the loss of sleep. Loss of sleep, actually. Okay, this whole combo, vexation, all of this together will finally give rise to the condition that Cocculus has. Anger, again, another important, very important causation. They were also sensitive to noise, also sensitive to touch, right? Least jar would aggravate. There's this motion sickness that they have. We have talked about motion sickness also. Overstraining, obviously overstraining, since they have been working so much, right? Mental as well as bodily. Tea drinking, and also sun. So all of those things caused problems for this remedy, right? And then we talked about this kind of a paralytic condition that we had seen in this remedy. The thing is, actually, first there comes a kind of slowness in this remedy, then comes a kind of a paralytic condition, and in which you actually have this kind of paralytic stiffness come on, and then finally comes complete paralysis, as we have seen. So what happens? Slowness. So in slowness, we have seen that all the nervous impressions are slow to reach to the centers. The patient, if you pinch the patient also, then his reaction will come on after a minute. You ask him a question, he will not answer just right away. He'll take a lot of time to think, and still he'll not be able to come up with a good answer. He's not able to actually think also clearly. He has plenty of time to even turn his head. So even he takes a lot of time to move, he takes a lot of time to think, he takes a lot of time for everything. So the whole economy is slowed down, the whole economy is inactive. That is what we talked about. Then in stiffness, we talked about the kind of situation where he stretches out his leg but he cannot flex it again, and he needs his hand to get some help, right? And then in complete paralysis, we saw various areas of the body, various parts of the body might get paralyzed in this remedy. Okay, that was what Dr. Ken very beautifully explained to us. Then we moved on to talk about the other characteristic symptoms of this remedy, which were the sensation of hollowness, first of all, or the sensation of emptiness that these patients feel. They feel that as if there is no content in the cavities of their body, and along with this, there is a kind of lightness, sensation of lightness present. Then there was this tendency to faint that is present, fainting from any and everything. There's this numbness, which is a great feature of this remedy, as Dr. Kent says. There's prostration and nervous exhaustion in this remedy, right, that we've seen. So all of that. Then finally we talked about motion sickness, and after that also about vertigo of this remedy. In motion sickness, again we've seen any kind of traveling that he does. He might travel from boat or in a carriage or in a car or in a train or in a bus. Any and every kind of motion traveling and through a vehicle is going to give him motion sickness. So what happens in motion sickness? He gets a headache, he gets vertigo, he gets pain in back, he gets nausea, vomiting, right? All of that is present. Along with what? Along with the kind of feeling that she would sink away. Along with a kind of faint feeling, right? And the main issue was that her eyes could not accommodate to the moving objects around, and that would immediately give her nausea, right? And then we talked about nausea cocculus, since we were on the topic. So we saw that the nausea is aggravated from smell or even thought of food, like we've done colchicum. And then we see that in this remedy, the vertigo is such that the patient has a tendency to fall sideways, and it comes from again loss of sleep, from motion after eating, and also it is there from rising from the bed, and it is along with nausea. Lying down becomes necessary for this patient. Okay, so he has to lie down. Lying down becomes necessary. So all of that is there in this remedy. So I hope you understood this much, and we're going to talk about this remedy much more, about the mind of the remedy, about the GIT of the remedy, and many more things. So meet you again in part 2 of Cocculus. Right now, please go back and read this remedy from various different Materia Medicas. Bye bye.